Okay, so I'm going to show my surroundings. Okay. Come in. Hi, Kylie. I'm going to be your student nurse today. Hi. I'm going to provide privacy, perform hair hygiene, and bed. Okay, can you tell me your name and date of birth, please?
Monica Valencia, 1/2087.
Okay, and do you have any allergies to food, latex, environment, or medications?
Latex.
Latex? Okay, can I just check that on your wristband? Okay, and what is your age?
34.
You're 34? Okay, and are you married?
Yes.
Yes, and do you work?
No.
No? Okay, so I'd make sure to document all of that. So what brings you in today?
I have a pain in my knee.
You have a pain in your knee? Which knee exactly?
This one.
That one? Okay, and what kind of pain is it? Is it like a sharp, an achy, a dull?
It's a sharp pain.
It's a sharp pain?
Mm-hmm.
Okay, and on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you could imagine, what would you rate your pain at?
I would say about a 5.
A 5?
Mm-hmm.
Okay. Is there anything that makes it better?
Icing it.
Icing it? Okay, and what makes it worse?
Walking.
Walking makes it worse?
Mm-hmm.
So does it prevent anything else in your daily life other than walking?
No, that's it.
No? Okay, and what happened?
I'm not sure. I must have hit it or something because it just hurts.
Okay. So I'd make sure to document that really quick. So I'm going to ask you a few questions about your history. So did you have any childhood illnesses such as chickenpox, measles, or mumps?
Chickenpox.
Chickenpox?
Mm-hmm.
And how old were you?
I think it was 4.
You were 4?
Mm-hmm.
Okay. And are you up to date on your immunizations?
Mm-hmm.
Yeah. When was your last flu shot?
Last year.
Last year?
Mm-hmm.
About what month?
This time. What?
Last February?
Mm-hmm.
Okay. And do you have any other allergies that I should know about to medication, food, latex?
No.
Or the environment? No? Okay. So how are your parents? Are they living?
Uh-huh.
Yeah. Are they well?
Mm-hmm.
Yeah. Do they have any underlying diseases such as hypertension, diabetes, or cancer?
Nope.
No? Okay. So I'm going to move on to a functional assessment. What is the most education you've completed?
Some college.
Some college? Okay. And how's your financial status? Is it adequate for your lifestyle?
Yeah.
Yeah. What about any self-care behaviors that you've partaken?
Just showering every day, brush my teeth.
Okay. And do you have any religious preferences that I should know about?
I'm Christian.
You're Christian?
Mm-hmm.
And does it prevent anything in your medical health?
Mm-mm.
No? Okay. So I'm gonna ask you a few questions about your daily life. So how is your sleep and rest patterns?
Good.
Yeah.
Pretty good.
How many hours of sleep would you say you get?
Like 6 to 7.
6 to 7?
Mm-hmm.
And do you ever take any naps?
No.
No? Okay, and do you partake in any alcoholic beverages or any other substances?
Yes.
Yes?
Mm-hmm.
What do you partake in?
I drink.
You drink?
Mm-hmm.
Okay. And how many nights a week would you say you drink?
3.
3?
Mm-hmm.
How many drinks per night?
Maybe 2.
Maybe 2?
Mm-hmm.
Okay. So if indicated as it is, I would perform a CAGE assessment. So do you ever feel like you should cut down on your drinking?
No.
No? Do you ever feel annoyed by what people say about your drinking?
No.
No? Do you ever feel guilty about your drinking?
No.
I'm going to make sure it doesn't fall asleep. And do you ever use alcohol as like a way to get you going for the day, as like an eye-opener?
No.
No? Okay. So I'm going to go ahead and move on to a depression assessment. So do you ever feel, in the last 2 weeks, have you felt down, depressed, or hopeless? No? In the past 2 weeks, have you felt little interest in doing anything?
No.
No? Okay, if indicated, I would perform a PHQ-9 screening, and I would ask the patient if they have had any thoughts about killing themselves, or if they have had any feelings that life is not worth living. Okay, so now I'm going to move on to a violence screening. So because domestic violence is so common in our society, we're asking all of our patients these questions. So do you feel safe at home?
Mm-hmm.
Yeah. Does your partner ever hit, kick, punch you?
No.
No. Does your partner ever force you to have sex?
No.
No. Okay. And are you afraid of your partner?
No.
No. Okay. If indicated, I perform a danger assessment. So now I'm going to screen for any the mental status. So for appearance, your posture is erect. Your movements have been smooth. your grooming and hygiene are adequate. Your dress is appropriate for the occasion and for the weather. For behavior, I note that you are alert and responsive to me. Okay, so for cognition, I note that you are alert of your place, time, and date. I note that you have been able to hold a conversation with me and you have made sense. And I would also note that I do not know any suicidal ideation. Okay. So at this time, I'm going to go ahead and assess your vitals.
Okay.
So, do you mind if I see your wrist?
Mhm.
Okay, I'm just gonna assess your pulse. Okay, so I note that your pulse is 84. That is within normal limits. It should be anywhere between 60 to 100 beats per minute. Your respirations was 14, which is also within normal limits. It should be anywhere between 12 and 20 beats or respirations per minute. I'm gonna go ahead and move on to checking your pulse. Your oxygen saturation. Okay, so I'm gonna clean it. Okay, and can I see your finger? Okay, moving closer. Do you mind relaxing? Okay. I'm also going to check your temperature. Okay, do you mind taking off your mask? Okay, lift up your tongue. Okay, and I'm just gonna leave it there. Oh, thank you. Okay, so your oxygen saturation is within normal limits. I note that it is at 100%, which is really good. It should be anywhere between 95 to 100%. Your temperature is 98.2, which is also within normal limits. It should be anywhere between 96.8 to 100.4. So I would go throw this away. It's far. How do I reach it? Okay, oh, my computer's falling asleep. Okay, still going. Okay, so at this time I'm going to assess your blood pressure. Okay. Do you mind reaching out your arm for me? No, whichever side you prefer. Okay, I'm just gonna lift up the shirt. So have you had any recent surgeries on this arm? No? Okay. Okay. And then I go ahead and gather a pillow to make it a little easier. Under your arm. I'm just going to feel for your pulse, okay? Okay, so I stopped feeling it about 80. So I'm going to give your arm a little break, and I'm going to ask you about your pain. So do you have any other pain today? have to have pain?
Yes.
Okay. Where's your pain located?
My side.
Your side? Okay. And what kind of pain is it? Is it like a dull, an achy, a crampy?
It's a dull pain.
It's a dull pain?
Mm-hmm.
And does it come and go, or is it pretty
Mm-hmm.
consistent? It
Mm-hmm.
comes and goes?
Mm-hmm.
Yeah. Okay, and on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you could imagine, what would you rate your pain at?
6.
A 6?
Mm-hmm.
Okay. And do you do anything that makes it better?
No, I haven't tried anything.
No?
Mm-mm.
Okay, and is there anything that makes it worse?
Walking around.
Walking around?
Mm-hmm.
So does it prohibit you from doing anything in your daily life?
No.
No? Okay. Sleep. Okay, so I would make sure to document that, and at this time I'm gonna complete your blood pressure.
Okay.
I'm gonna close that right there. Okay. Okay, so I heard your blood pressure at 110/76, which is within normal limits. It should be anywhere between less than 120 over less than 80. I'm just gonna go ahead and take this off, and you can remove this pillow from you. At this time, I'm going to go ahead and assess your weight. Okay, so do you mind standing up for me? Okay, and you can follow me over here. And go ahead and stand up there. Okay, I'm going to slowly move this. Okay, so I note that on this scale it says that you are 67, but I asked the patient ahead of time what their weight was because the scale is not calibrated completely. So the patient states that her weight is about 108, and I'm going to assess your height. Okay. So you are at 59 inches. Okay, so I'll convert your BMI in just 1 second. Do you mind standing here in a second so I can check your waist? Okay. Okay, so it is 29 inches. And at this time, I'm going to go ahead and ask you to do an eye exam. Okay, so if you could stand at this line. Okay, and that is 20 feet. Can you cover one eye, please? Okay, tell me which line you think you could read the best.
7.
7?
Mm-hmm.
Okay, can you read it to me?
It is FELOPZD.
Okay, and can you switch eyes?
It is probably 8.
8? Okay.
DEFPOTEC.
Okay, and both eyes?
I'm gonna go with number 9.
Number 9, okay.
It's gonna be LEFODPCT.
Okay, so I would note that the best the patient could read would be with both eyes, and I would note what the eye level was. I did not indicate that the patient leaned forward, had any hesitancy, squinted, or missed any letters. So at this time, if the patient had an eye exam less than 20/30, I would refer to an ophthalmologist. You can go ahead and sit down. So at this time, we're going to complete the assessment. I'm going to be assessing your body today, so if you feel any discomfort or pain, or if you'd like for me to stop, please let me know at any time.
Okay.
I'm going to start by assessing your head, okay?
Okay.
Okay. Okay, so I note that your head is normal cephalic. I do not know any elevations, depressions, or lumps. I note that the hair is evenly distributed and smooth. I'm going to go ahead and move on to your face. So your eyebrows are evenly distributed and symmetrical. I note that you're blinking and they close completely. I note that your eyelashes are evenly distributed. I can tell that your sclera is white and moist and your conjunctiva is pink, and I do not know any lesions or any discharge. I do not know any lumps or redness around the eyes or any other discharge. Do you mind pulling down your mask for me? Okay, the nose is in the midline of the face. The nasolabial folds are symmetrical, and can you smile for me? Okay, they stay symmetrical, and so do your smile lines. So your lips are pink. Do you mind smiling? Okay, so I note that the patient's teeth are straight, and there is not any absent of teeth, and the gums are not bleeding. Do you mind sticking out your tongue for me? Okay, I note that the tongue is pink and moist. I do not know any drainage anywhere else. At this time, you can put your mask back on. I'm going to move on to assessing your ears. Okay. So I know that they are symmetrical and they are pink. They are not red. Their skin is intact. Can you let me know if you feel any pain or discomfort? I do not know any swelling or lumping of the ears. I'm gonna feel behind your ears. Tell me if you feel any pain. Do you feel any pain? No. How about if I do this? Nope. No. What about this? Nope. No. Okay. This ear. Nope. This. Nope. No. Okay. So I would check the opening of the ear, and I note that they are normal size for the patient's ears. I do not know any cerumen, or and if I did, I would note the texture and the color of it. So I note that the patient's neck is erect and is in the midline of the body. I'm going to ask you to do a couple range of motions, okay? Do you mind bringing your chin to your chest? Okay, and looking up at the ceiling. Okay, and look left and right. And then can you bring your ears to your shoulder? And the other one? Okay, did you feel any discomfort? No? Okay, so if the patient did feel any discomfort, I would make sure to document that. I do not know any decrease in range of motion. So at this time, I'm going to move on to assessing your skin. So first, do you have any wounds or lesions that you would like for me to look at first? No? Okay, so I would ask the patient to lift up their shirts, but okay. I do not know any lesions or wounds. If there was a wound, I would note the location, the size, and the exudate date, which is the odor and the color. And if there was any lesions, I would note if there was asymmetry, a border, the color of it, if the diameter of it, and if it was larger than 6 millimeters. And I would note if there was any elevation to it. At this time, I'm going to assess for any edema on your arms. Okay, I do not know any edema of the arm. If there was edema, 1+ is mild, a 2+ is moderate, a 3+ is deep, and a 4+ is very deep. And I would assess the other arm. Okay, I do not know anything else. So I do not know any, the color to be jaundice, erythema, pallor, or cyanosis. I'm going to go ahead and assess your temperature. Okay, I noticed that you are warm, but you are not hypo or hyperthermia experiencing. So at this time, I'm going to assess your legs, and I would check for any wounds and lesions upon the legs as well. I'm going to go ahead and assess for edema. Okay, so I do not know any edema of the legs. If I did, 1+ is mild, a 2+ is moderate, a 3+ is deep, and a 4+ is very deep. I'm going to go ahead and assess your nails. Okay, so I note that they are smooth, they are not bitten to the quick, and I'm going to check for capillary refill. Okay, so I note that they are not more than 2 seconds. So at this time, I'm going to go ahead and convert your BMI really quickly. Okay, so you are 59 inches. Okay, so I note that your BMI is 21.8. Okay, so I think that completes my head to toe assessment at this moment. One last thing that I would like to do is I would like to assess your hearing. So if you would like to, if you could stay in front of me, just stay right there and raise your hand on the side that you hear my fingers rubbing, okay? Okay, and one last thing to further assess your mental status, I would like to ask you, how many months are in there?
12.
12, okay. And who is the president?
Joe Biden.
Okay, so that completes my assessment, and thank you, and I'll make sure to document all of my findings, okay? And I would perform hand hygiene and open privacy. And the bed was fully down.